Again, I thank you again for considering the New Jersey Social Impact Bond Act this afternoon, Mr. Chairman. Now I would like to turn the floor over to Michael Clerk, who is affiliated with the Fels School of Government at the University of Pennsylvania. Mike has worked closely with my office to help craft this legislation. And also let me just say thank you to Bill Moore, who also graduated from the University of Pennsylvania with a master's in public administration. You can smile. And who also worked closely with Mike in helping to come up with this legislation. So at this time, I'm going to ask Mike to please speak about more in depth of the bill. Mike.
Thank you, Assemblyman. Good afternoon, Mr. Clerk.
Thank you, Assemblyman. Chairman Gantino and members of the Assembly Commerce and Economic Development Committee, thank you for the opportunity to speak with you today about the New Jersey Social Impact Bond Act. By piloting, testing, and refining the social impact bond instrument, I believe that this legislation has the potential to incentivize the broad cross-sector collaboration necessary to address intractable social problems, to save taxpayers money, and to unlock new capital flows aimed at improving the public good. The following definition of social impact bonds comes from McKinsey & Company in their report titled From Potential to Action. A social impact bond is a new approach for scaling social programs. Currently being piloted in the United Kingdom and generating interest globally, a social impact bond is a multi-stakeholder partnership in which philanthropic funders and impact investors, not governments, take on the financial risk of expanding preventative programs that help poor and vulnerable people. Nonprofits deliver the program to more people who need it. The government pays only if the program succeeds. I've also heard social impact bonds smartly described as a way of monetizing Ben Franklin's maxim that an ounce of prevention is worth a pound of cure. At the very least, they can serve as a tool to scale evidence-based social interventions and can assist government and service providers in shifting to a performance management culture. The social impact bond also has the potential to incentivize structured collaboration and operations across the public, private, and nonprofit sectors, as well as catalyze virtuous cycle investment, where private investors are encouraged to keep investing in the prevention of a given social problem and to a progressively greater degree. The New Jersey Social Impact Bond Act would pilot the instrument in the field of healthcare, a social area prime for evidence-based and preventative service delivery models. 5% of patients account for 60% of healthcare costs nationally, and there's evidence right here in New Jersey of patients ringing up multi-million-dollar bills by themselves. A social impact bond will allow us to invest directly in health rather than simply reacting to the unhealthy. A social impact bond could provide a structure to aggregate costs around patient cases, something that currently isn't being done, which, along with preventative service delivery, would serve as an important model for curbing the cost of healthcare. The pilot program could fund innovative and preventative solutions aimed at reducing, for example, Medicaid and employer-associated healthcare costs. Potential solutions include, but are not limited to, the work right here in New Jersey around hotspotting, the process of identifying the costliest superutilizers of healthcare in order to provide comprehensive preventative care and to reduce costs. Or a replication of the program in Fresno, California, initiated by Collective Health, to identify and systemically address the root causes of asthma. Or to roll out the transitional care model, which has been defined as the provision of effective, comprehensive, and evidence-based in-hospital planning and home follow-up for chronically ill, high-risk older adults. Each of these solutions are well-researched and evidence-based and could trigger significant cost savings for government and save taxpayers money. The role of the study commission identified in this legislation would be to identify the intervention model for the social impact bond pilot. Also, the presence of the study commission will allow for the instrument to be analyzed and refined for future social impact bond funded initiatives. The social impact bond serves as an attractive alternative to traditional philanthropy and to philanthropic investment. Once the model is tested and refined, it could also prove attractive to more mainstream investors. The instrument shifts risk away from government, requires fiscal discipline, and promotes efficient use of resources. Additionally, many local governments currently do not have financial instruments in their economic development toolbox to directly address social problems. Elected officials, business owners, and citizens are all aware of the link between education, crime, and healthcare to a region's ability to increase economic activity and to attract residents. While some instruments assist in building stadiums and shopping centers like tax increment financing or promoting real estate activity like tax payments, no financing mechanism currently exists to directly address the social aspect of economic development. This would put a really sharp tool in that toolbox. Finally, this instrument could alleviate some issues inherent in the nonprofit sector. Currently, affected nonprofits with evidence and results currently have a hard time finding the capital necessary to scale up their solution. The social impact bond addresses this issue. The potential for an instrument like the social impact bond is massive, but again, the concept must be tested, refined, and proven. New Jersey could lead the way in piloting this instrument and serve as an example for the rest of the country in the field of social innovation. Passing this piece of legislation would be a very important first step. I commend Assemblyman Fuentes and the bill's other sponsors for their work on this subject. I thank the committee for their time and will be happy to answer any questions.
Thank you. I was remiss, Mr. Clark is from the Fels School of Government at the University of Pennsylvania. I think we should just have that for the record as well. Any questions of Mr. Clark or Assemblyman Fuentes? Assemblyman Munoz.
I have a lot of questions. Well, I would say, wow, because it means a lot of words, but I don't know that it necessarily, first of all, I come from the health committee and I'm a nurse, so, and we have lots of programs that are in place now that we are trying to deal with the healthcare costs. The ACA, the affordable, not just the ACA,